You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Thank you for tuning in to another episode of Extracting Wisdom, the podcast that helps prevent the decay of your future. My name is Brandon Evert, and today we will be discussing a recent event that occurred in Indiana at Indiana University School of Dentistry called the Midwest Hackathon. And joining me are the two students who are responsible for planning the event. We have fellow UIC student who is a current D3, Ben Richardson, and another D3 from Indiana School of Dentistry. You may know her from her Instagram account, The Tooth Diaries, Lauren Sheline. Ben, Lauren, thanks for being on the show today, guys. I appreciate it.
Oh, thanks for having us. We're really excited to talk about the event that we just had. It was awesome.
Absolutely. Thanks, Brandon.
Absolutely, guys. I'm so happy we were finally able to make this work. I know we're all very busy people, and we got a lot of schedules going on. So I'm glad we were able to sit down for a couple minutes here and just have a quick little chat about the hackathon. So let's start out with this. I always like to ask my guests on the show kind of why they chose dentistry. So Ben, why don't you go first? Tell me, what's one thing about dentistry that you really love, and one thing that kind of made you pursue a career in it?
Oh, wow. Sounds like a typical interview question.
Yeah, I know, but it's interesting.
No, that's right. That's okay. So I guess what got me interested in dentistry was I had a really good relationship with my general dentist back home. And I just really enjoyed seeing how he worked in his office and how much respect that his assistants and the patients gave him. And I thought that sounded like a really cool career path for me. I always loved the sciences, so I kind of combined the two and started to pursue dentistry as my main choice. I guess when I first started college, I started shadowing different dental offices. I was interested in not just dentistry, but other specialties as well, like endodontics and oral surgery. So I just kind of went from there and applied to dental school, and was happy to get into Chicago here.
Yeah, awesome. And Lauren, how about you?
So my background is actually a little bit unique in that I've been around dentistry for as long as I can remember, because my dad is a dentist in Indiana. He practices in Elkhart, and I just remember being in his office from as little of an age as 4 years old and just absolutely loving the environment. I thought that it was super fun, which I feel like, I don't know, I know it's sciences, I know it's healthcare, but something about teeth is just so much more fun than any other healthcare profession. And I feel like my dad made it that way. And he used to have like big tooth models and all of this sorts of thing that I just thought was the coolest thing. And so then I got older, I also began to see how much of a personal profession it was. You have such a great relationship with your patients, and I'm totally an extrovert and love to be around people and encourage people and my strengths to the best of my ability. And I just felt like dentistry was a fit for me. It just fit all of those categories and things that I was looking for in a future career.
And here's one more question for you, Lauren, because I'm sure a lot of my listeners have seen or have followed you on Instagram, and you have an awesome account. What made you start that Instagram page?
Yeah, that's a great question. So the reason that I started the Tooth Diaries to begin with was I just felt like this pull to have some sort of creative platform to really share my journey through dental school, but also to encourage others who are interested in pursuing a career in dentistry, encouraging them and shed a little bit of light on the things that maybe we don't talk about in regards to like the application process. I myself was a multi-cyclist, I guess you could say. It took me multiple times to get into dental school, but I still knew 100% I was meant for this career. And so if I could encourage one or two other people to just be that, even though maybe you didn't get in the first time, that you can still be successful with a career in dentistry or whatever healthcare field you decide to go into. And also I wanted to also encourage other people just to see how fun I thought dentistry was, and to kind of give it a new vibe rather than this just serious, we pull out teeth, people come see us with a toothache thing. Like, I wanted to make it a really enjoyable profession and to really portray it in that way. So those are kind of my goals with my Instagram and the platform that I've created.
And it's important to know us dentists or us future dentists are a lot more fun than it appears to patients.
Yeah.
A long way.
Yeah. Okay. So what I really wanted to talk about is this hackathon that you guys arranged. So Ben, how about you take it away first? Just kind of tell us a little bit about what the hackathon was and what kind of the idea behind it was.
Sure. So the hackathon was actually something that was started up with the Boston dental schools, in which they took the idea that students can come together and they can talk about different ideas and new ideas when it comes to changing dental curriculum, improving certain aspects of it, and basically just starting from scratch and creating their own four-year ideal dental school curriculum program. So it was been very successful in the Boston schools, and Indiana had their very first own hackathon last year, which I'm sure Lauren can talk more about to that, and which is why we decided to have the Midwest hackathon at Indiana this past year, or this past few weeks, and made a great success having that experience from Lauren and the other students that ran it last year. So basically, when we decided to do it this year, Adia wanted us to take it on, and we got some really great funding from one of our sponsors, Hugh Freedy, as well as a lot of funding from several of the colleges that participated, especially UIC, IU, and Louisville. So with all that extra funding, we're able to get several schools involved from the Midwest to partake in this event this year, and it was a great opportunity to hear ideas that other dental students have and hear about their programs and kind of combine ideas and work in teams to create a new curriculum. So I think we can take from this event is that we can present it to our curriculum committees at our respective schools and actually make a difference in dental education for the future.
What school? Who was all there? What schools were there?
So we had IU, Louisville, University of Illinois, Chicago, Nebraska, AT still in Missouri, and am I missing one, Lauren?
Iowa.
Iowa.
Yeah.
Thank you.
Iowa. Was Marquette there too, or no?
They were not. No.
Oh, okay.
We reached out to several schools, and it was tough for some of them to travel the distance to get there. We tried to pick Indiana because it's a central location, and that was the number of schools that we got. If they try to, I don't know if I'll try to do it again next year, but if someone else takes the reins, hopefully they get more schools involved as well.
Right.
And that amount of schools, actually, that was the greatest amount of schools that a hackathon to date has had, yeah, which was a huge feat in itself to have had as many as we did. I mean, yeah, and the amount of students that came also, we had 75 to 80 dental students from within the Midwest. And so we were able to accomplish the biggest hackathon to date.
Mm-hmm. Well, congratulations in organizing that. I'm sure that was a ton of work, but I'm sure you guys took away, a lot from that. And that's kind of what I want to get into is what are some of the things that you guys talked about and what are some of the things that you guys kind of took away hearing, different viewpoints from different schools?
So I actually this year did not participate in a group, so I'll let Ben give a little bit of insight into how his experience was. But one of the players for the team that won for the hackathon had a couple main points within the curriculum that they came up with, and the main concept behind their new curriculum was trying to eliminate long class days and add online dental courses, eliminate overlap and repetition between courses, and really consolidate the material that we're being fed as dental students. They also really emphasize getting more externship experience within the fourth year of dental school, private experience that any of us are not exposed to. And we so often, as you get into clinic brain experiences, I mean, two patients a day for 3 hours, that's not really conducive to a private practice environment. And so making sure that we're hitting the big stuff in our first year of dental school, and then by our fourth year, we can start that transition into the dental environment that we're going to be practicing in for however long. So they really just tried to come up with tangible ways to address common dental school problems that a lot of us as dental students have brought to the table and complained about. And I think that it caught the judge's eye their push for that private practice experience. And that's what the winning team's focus was on.
Mm-hmm.
Ben, do you have anything else to add? Like what was your situation? Talk about kind of the group you were in and kind of what are some of the things you guys came up with.
So I definitely agree. Lauren was saying, it seems like a popular thing that we discussed was the opportunity to do more online classes and then substitute that to get more clinic experience, especially early on. I know a lot of dental schools and students, they don't get a whole lot of rotation experience those first 2 years. I think it'd be nice to get the students involved right away in the clinics and get an idea of what they're getting into. The more experience, the better, really. And I think that was a lot of cool ideas that our group talked about, especially one where have students the first couple of years do some screenings with patients and take that responsibility away from the D3s and the D4s who already have a lot of patients and don't have a lot of time to do simple dental screenings, which is just like a 10-minute meet and greet with a patient to see if they're qualified to be a student or be a patient at the college. So that was cool. Also, maybe do rotations through urgent care or just regular assist rotations with other dental students, upperclassmen. I think schools trying to integrate that more might be a great idea. And I think a lot of groups presented something like that in their curriculum. Also, like Lauren was saying, getting rotations outside as well, is a great idea in local dental offices, hospitals, and whatnot. So having more time for that, because dental school is already jam-packed the first 2 years, especially with classes. I know, Brandon, you're finished, in your D2 year now. You know how busy you are.
Oh yeah,
it's hard in our current curriculum at UIC to squeeze in more things already. But if we just kind of shift some things around, maybe introduce more online options for people, that'll open up a window for everyone.
And another big topic, Brandon, before we move to the next question, was the INVGE, the new integrated dental boards. I think a lot of people were also targeting switching these curriculums so that we're better prepared for taking the integrative exam as opposed to the two-part national board exam that most of us have taken. But these new first years are going to be taking something completely different, shifting classes to be more based, less rote memory from books, and trying to find ways to better prepare for this new big board exam that they just this is the first year that they're going to have. So
yeah, absolutely. And that's, I think, something that UIC right now is really working towards. And one of the biggest components of UIC's curriculum is SGL, or small group learning, which is kind of, we're given a case and we work on it as a group. Ben, are you seeing a lot of other schools have similar curriculum like small group learning?
And Lauren, I think I remember talking to several of your classmates in our group. Like SGL used to be something that was bigger in Indiana, and then they got rid of it. Is that correct? And you don't have it anymore.
Yep.
So I think a lot of schools are doing away with it. I think, and I think the main reason is that you just don't have enough faculty to sit in on group discussions, and there might be other reasons too. I know that's kind of the main reason I heard at UIC. Was the issue, because I do enjoy small group learning. I like learning from my peers, and I think it's a great way to talk about cases and retain the material in memory. I don't know if the future is too bright for it, but there's other options too, like team-based learning where you work in bigger groups and doesn't require as much faculty. And that's currently what we're doing in our D3 year right now. So like Lauren was saying, that was definitely a big discussion too, was can we do more small group learning, and how do we fit it in with integrated boards and everything now too? So, because I think it was really helpful to have the SGL when we were preparing for our Part 1 boards, which is no longer a thing for the rest of the classes. So.
Right. Yeah. My class has the great fortune of being the guinea pigs for the new boards. So we'll see how that goes. Have you heard anything about, like what kinds of questions there are going to be, or how different it's going to be from like Part 1 and Part 2?
There was a small presentation about the new integrative dental boards at this past spring ADIA annual session in Chicago. And they briefly spoke about it. I think that the goal is that it's not supposed to be harder or less than the current NCE exam. I think that they had a bunch of students take the test as part of a trial run, excuse me. Mm-hmm. And they had said that it was comparable to the current NBDE. I think that the big change is that you don't have to spit off random facts about Addison's disease or like, different things like that. You're going to be presented with real clinical cases and then be able to, from that, deduce and, use that information to dive deep into what you've learned and apply it in a scenario that you might face later on in your dental career. So they didn't give any examples to what those questions are like, but I think it's just going to really try to make you think. And I think it's a wonderful thing also that you will only have to take one exam. And you
That's
don't
true.
have to prepare twice in your dental career, only that one time whenever your school has you take it.
Right. Yeah. And I think that's a big thing too, as you guys are talking about, and kind of the whole point of the hackathon is getting closer to preparing students for what life is actually going to be like in a dental clinic. And actually, I had a guest on about 2 months ago. I think he was from Kentucky's College of Dentistry. And one thing that really kind of opened my eyes, he said that they would learn a certain crown prep or a cavity preparation at the beginning of the week. The middle of the week, they would practice it in the sim clinic. And then by the end of the week, they would actually perform it on a patient, but just that part. They would have an older student or the supervising doctor kind of will anesthetize the patient and do all the other work except the crown prep and leave that to the D2 student, which I thought was, it might seem insane, but it's an awesome way to kind of get that early exposure into the clinics.
Mm-hmm. Yeah, that's a good idea. Yeah.
I think that's awesome also because I feel like now that I'm in clinic, Ben and I both went through this extensive fixed prosthodontics course. How many crown preps did we probably do? And then here I am, in the fall of my D3 year, and it's not looking like I'm going to have a crown prep for a while. And then I'm just going to pull out a crown prep on a patient for the first time, and I've never done one. So I think that's a great idea, as scary as it sounds, to do a crown prep after you just learned it, but to be able to have an opportunity to actually perform it on a patient, feel what that's like clinically. I think that's the whole point of the dental learning environment. So I think that's great.
Yeah, absolutely. Another thing that I was kind of just thinking about too, did you guys talk about anything kind of changing in the curriculum of moving more and more towards digital dentistry? Because that's such a big thing now. And a lot of practices, I was just watching, I don't know if you guys know who the millennial dentist is. He's another podcaster, but on his Instagram story, he posted a couple of videos of him throwing away all of his stone and everything that has to do with models because he's now completely digital. Did you guys talk about anything about that, about more of the digital side of dentistry?
Yeah, I think a lot of groups did talk about digital dentistry a lot. I mean, like CAD/CAM and all of these new technologies that we have in the future, that's a huge part of it. And I think a part of the changing of courses is encouraging older faculty that maybe aren't familiar with these practices to start to adapt those because, like you just said, many dental offices now are completely digital and are not using these antiquated techniques that we're learning in lab. And we've been using Snap as a material. I don't know if you guys use this, but just finally this year, they stopped having students use it for provisionals because no one uses it anymore. Why would we need that? So I definitely think that was a hot topic in a lot of the group presentations, is getting more exposure to digital dentistry. I know at IU, we've started to pilot a couple courses that some people can sign up for in regards to like CAD/CAM and being able to mill your own crowns and be able to have that experience, whereas we don't often get that in clinic because there's not enough means for everyone to use an intraoral scanner with their patient. So I think that's definitely important and was a big topic as well among our dental students at the hackathon.
Mm-hmm. And yeah, we in our group, we didn't talk too much about it at the hackathon, but I will say at UIC, I know we're definitely increasing the amount of classes we have with digital, and the requirements in clinic are increasing too for the amount of digital work we need to do, whether it's inlays, onlays, or full ceramic crowns or something like that. And I know D2 year, Brandon, you're probably getting ready to get into some digital, correct?
Yep.
So you'll definitely, I think they're increasing the amount of classes you're going to have with digital, because since you have the integrated boards, they're going to have more, I think, structure with the digital side, and as well as with endodontics for you guys too, is what I understand. So I think it's, definitely a bright future with digital, as we're going to keep seeing more and more changes to the curriculum with that being at the center. So it's pretty cool.
Yeah, that's awesome. So just kind of overall with the hackathon, just kind of, slowly starting to wrap it up here. What was like the biggest takeaway from the hackathon? Like, are you guys seeing dental schools really pushing to make change, to kind of adapt the curriculum towards more of, preparing students more for what the world of dentistry is like right now outside of dental school?
Yeah, I would say definitely. And just based on the amount of support we got for this single hackathon from ADIA, from all the dental schools that participated, from the deans of the dental schools that participated, we were very lucky to have both Dean Stanford from UIC and also Dean, the new Dean of Indiana. I can't pronounce her name, Lauren.
Dean Murdoch.
Yeah. And Dean Williams was a big proponent of it too, the former Dean of Indiana, and really helped us kind of get it going. So I think the fact that the deans are very interested in this shows that they really care about student opinion. And that's what the hackathon is all about. And so we hope that this hackathon we put on will set a great precedent for future hackathons and continue to make changes across the country for creating new dental curriculums. But I think the goal eventually that ADIA wants to do is to create a national hackathon where we get as many dental schools as we can together in a single location and put on a major hackathon, and then take the changes that we make from that hackathon and actually make a really big difference across the country. So I think that's also a future goal. At home here at UIC, my big takeaway was to take what I learned from this Midwest hackathon and host our own UIC hackathon to make changes here at UIC, which I hope we get a lot of students participate. I hope all dental schools are able to hold their own as well, because it's great that we get together at different schools and hear feedback from them, but being able to host your own hackathon and then have the faculty from your own school see what you're talking about can actually make a huge difference.
I would completely agree with Ben, and I think that the thing that was so great, or the thing that got me most excited about the hackathon, was just the excitement that the faculty had for listening to the dental students' voices and opinions about this very curriculum that we're experiencing now and how we feel like it could be better for generations. And I just think the openness to that is fantastic, because, for dental students, I feel like we often forget the voice that we have and how important it is. So to see so many students come together and be able to stand up and say, like, these are changes that, like, we could see happening in the future, and we are the future faculty of dental schools. So I think that's important that we're involved, just like we're at the event. And I'm excited to see what tangible changes come from this event and then hackathon.
Awesome. Well, thanks again for organizing this, guys. I'm sure all the schools in the Midwest really benefited from it by sharing ideas and being able to see what other schools are doing and what other schools aren't doing. So thank you so much for organizing that. One more thing before I let you guys go. I have my very first endo molar access tomorrow. What are some of your endo tips? Do you guys have anything off the top of your head?
Don't perforate the tooth. We did that on my molar endo access in my clinic, and I had to redo it, and it wasn't fun. But yeah, I don't perforate the tooth. That was good advice.
And you said it's a lower molar, Brandon?
Yeah, we're doing maxillary and mandibular tomorrow.
All right, well, if it's a maxillary molar, make sure you try and find that MB2 canal, because it can be hidden in there somewhere, so don't forget about that guy. For the lower molar, just make sure you open up that distal canal really well, because even though it may look like one canal, if you use the orifice opener on it, you're going to find two canals. So Dr. Baker, who's at UIC, one of our endodontists, he always says, orifice opener, use it for everything as much as you can. So that's my tips.
Awesome. Good to know. Well, I'll wish me luck tomorrow. We'll see how it goes.
Good luck. You'll be great.
All right, guys. Well, I know, Ben, you got a flight to catch. I just want to say thank you guys for being on the show. We will wrap it up here, and maybe we'll do another episode again in the future.
I'd love that.
All right, guys. Thanks so much.
Thank you for having us.
Absolutely.
Thanks,
all right,
Brandon.
Yeah. Take care.
All right. See you, Lauren. Bye-bye.
Bye, Ben.
I just need